Need to clear out my cloud. All right, well, let's go on and get started. I just want to welcome everybody and thank you all for supporting Social Workers of Alabama as we continue to try to bring you continuing education that matters. And we try to come with the best of guests. And I have to credit Dr. Lewis for that. She selects our guests and she always comes with it to the point to where we are just learning so much from each and every presentation. So one thing that you can expect is we've been getting a little bit faster with submitting or issuing out the continuing education. Well, we do ask that you do give us until Friday. It is very likely you can receive them by tomorrow or after tomorrow. We've been getting them out lately within about a day or so. But if you haven't heard from us by Friday, please get in touch with us so that we can make sure that you get your credit for attending this live event. Um, and so, um, yeah, I think that's it as far as that. Housekeeping, some of us will get kicked out if I don't see you. I'm going to just keep an eye out and so that we can bring you back in. I know with Zoom, sometimes that happens. But we're going to get on started with today's presentation. Of course, the title is Disordered Eating, Body Image and Exercise Dependence in Athletes. And this is going to be presented by Dr. Alyssa Reno, excuse me, Reno Smith. And like I said, we're bringing top talent here to present, and we're proud to do that. And Dr. Alyssa Reno Smith is a clinical assistant professor at the University of Alabama in Huntsville and a registered dietitian nutritionist licensed in Alabama. In her academic role, she teaches courses in nutrition and exercise science. She mentors students entering into kinesiology, E equals ELD. Some of y'all might know about that. I hope I said that right. And conducts research on athlete health and well-being. She is also the owner of the Non-Diet Sports RD, a private practice dedicated to helping athletes fuel for performance while developing a healthier relationship with food and body. Her professional interests center on the intersection of sports, nutrition, body image, and disordered eating. Dr. Reno Smith has presented at regional and national conferences and is passionate about raising awareness of the unique challenges athletes face related to body image and performance pressures. Her dual role as educator and practitioner allows her to bring both clinical expertise and practical strategies to her work with athletes, coaches, and healthcare professionals. Without further ado, we're going to turn the mic over to Dr. Alyssa, and we're going to, let everybody else in. I'm going to turn it over to you, and thanks so much for joining us today.
Yes, thank you. I'm very excited to be here, and this is one of my favorite topics to talk about. It's a difficult topic to talk about sometimes, but it is, we need to raise education and awareness on it. So, thank you, and thank you for that introduction. I think you hit all the major points. One other thing I wanted to add. So, I was a college athlete myself, and so this is kind of where my interest and passion derived from. Navigating my own challenges with fueling my body to support performance. And then I am a recent new mom. I have a 7-month-old daughter, and I like to tell everyone that this is my favorite job yet. So I am looking forward again to being here, and thank you all for tuning in. So we're going to get right into it. We're going to just define disordered eating, body image disturbance, and exercise dependence in athletes. We're going to identify common risk factors and warning signs, examine physiological and psychological outcomes, including what we call relative energy deficiency in sport or REDS, and then talk about a little bit of how fueling affects athletes and multidisciplinary care approaches. And I do welcome questions, so if you have questions at any time, feel free to drop those in the chat or, raise your hand. And so let's get into some key terms here. So, disordered eating encompasses a range of what we call unhealthy eating behaviors, which can significantly impact the athlete's physical and mental health outcomes. And exercise dependence is characterized by compulsive exercise behavior, which often, if athletes are experiencing this over time, it can lead to injuries, impaired recovery, fatigue, and then some other detrimental psychological effects on their overall well being. And body image refers to how athletes' perceptions and attitudes towards their own bodies, and they influence their nutrition and exercise behaviors, which do contribute to disordered eating patterns as well. So I think you'll see tonight how these are all kind of interrelated factors, and how if one athlete experiences one of them, then they may, it's likely that they experience another one too. So, just a little bit more on disordered eating. It does exist on a continuum, all the way from one side of the spectrum of optimal fueling to restrictive disordered eating processes, and then to a clinical diagnosable eating disorder. And unfortunately, athletes can fluctuate on one side of the spectrum to the other, and that can create further concerns in athletes as well. Prevalence in athletes, and we're talking about, anything from recreational to elite athletes is what the literature covers. And so this is going to be estimated to be about 21 to 76% in those sports that are emphasizing aesthetic, image. So things like gymnastics or sports that they have to achieve a certain body weight, like wrestling, or MMA fighters, those types of sports there. And then endurance sports are also where we commonly see eating disorders as well. But what about non-traditional sport paradigms? Well, this is an area of research that I do, and it is evolving. And it's important to note that, eating disorders don't just affect those sports that do emphasize that thin ideal. They can impact sports where muscular oriented culture is very prevalent. So something like CrossFit, or team sport paradigms as well. And it's also important to mention that they affect all different types of athletes. Doesn't matter, what the sport is, all different types of genders. And it's not just narrowed down to those in that thin ideal. I was a college athlete thrower, and disordered eating and eating disorders were prevalent in my teammates as well. And some risk factors to be mindful of that can contribute to disordered eating and worsen disordered eating include perfectionism. Athletes strive for perfectionism in their sport and to be the best athlete they can be, whether that's doing anything they can to improve their performance or achieve, a sport specific body ideal, or achieve a social media body ideal. So they're kind of navigating all these different pressures, both internal and external sources. So, internal, that self imposed pressure they're placing upon themselves, and then external, those things I kind of already mentioned: social media pressure, pressure from coaches to, achieve and maintain a specific weight, maybe from teammates. There's just all these kind of snippets all over that are creating to these internal, external pressures, which can worsen perfectionism, anxiety, all these things. And weight class requirements, I kind of touched on that, but again, those sports where they do have to achieve a specific weight, we do see disordered eating and eating disorders are prevalent there. Social media exposure, I talked about a little bit, and I'll continue to talk about it. But social media, again, they portray and they have this idea of what an athlete should look like. And for female athletes, that's typically that thin ideal that I'm talking about. And for male athletes, it's extremely muscular. So trying to live up to essentially unattainable standards. And then transition stages are when athletes are in those critical developmental stages in life. So, when they are around 7 to 9 years old and they start kind of dipping into team sports, that's a very vulnerable time for them to start getting exposed to some of these things, but also high school athletes and college athletes in that transition as well. Oop, there we go. So, diving into these psychological risk factors a little deeper, we talked about perfectionism, but it can drive athletes toward these disordered eating, exercise dependence patterns as they try to push for that unattainable standard, which can impact their mental health, their performance, and their overall health later on, too. So, it's kind of a domino effect there. Coaching styles that emphasize appearance and performance metrics may also increase the risk of disordered eating, creating an environment of pressure and unrealistic expectations. So, a lot of times, coaches don't realize the significant impact that they have on athletes. And one simple comment that they make to an athlete can truly impact them for the remainder of their life. And so, just being mindful of that as well. Now, sometimes it can be kind of confusing, the difference between an eating disorder versus disordered eating. And so we're going to break that down for you. Disordered eating is when, these pathogenic behaviors are being used to control weight, but they're irregular. So it's not a consistent pattern. Thoughts of food and eating do not occupy most of the day. They're still there, but they're not, consuming 100% of their thoughts per day. And their functionality is going to remain intact. So it's not impacting their everyday lives, their relationships, those things where we do see that impacted with eating disorders. Preoccupation with food and exercise and body image is present, but energy intake or dietary intake tends to be acceptable. And I use that term lightly because somebody who is experiencing disordered eating patterns, it doesn't mean that that can't be, just as harmful to their health as somebody with a diagnosed eating disorder. And they may also have a cognitive focus on burning calories while exercising. So they're very hyper focused on the amount of calories that they're burning. Whereas eating disorders are diagnosed based on the DSM-5 criteria. There are specific criteria for restricting binging and purging as far as like how many times per week and for the past several months. Their obsessions and thoughts with eating are occurring most of the day. So this is where their thoughts of food, body image, all those things are occupying about 70 to 100% of their day. Their life activities, their relationships, their job, all those different kind of activities are impacted. Their preoccupation with healthy eating leads to significant restriction, and then excessive exercise may be used as purging carbs. So, as a sense of, making up for consuming carbs when they think that carbs are bad. And it doesn't have to just be carbs, they may just be exercising excessively to burn a certain amount of calories. But nonetheless, I can't stress this enough. Disordered eating can be just as harmful for the health and performance of the athlete as a diagnosed eating disorder. So, some warning signs that we can look for: frequent dieting or weight control behaviors, anxiety associated with specific foods or meal skipping, and also a state of anxiety if familiar foods are not available or they don't have access to their specific foods that they want to eat, especially like if they're traveling for a game or a tournament. We may see them starting to eat in isolation. So whether this is a team meal situation or, just eating, they're not eating with their teammates or they're not eating with their roommates, they start to eat alone. In a non-athlete situation, this could be somebody like going up to their room and eating alone and not eating with their family. Chronic weight fluctuations. So we're, in this constant kind of state of gaining and losing and gaining and losing. It just repeats there. They have rigid rituals and routines surrounding food and exercise. So an example here would be having safe foods. Again, kind of just those that short list of foods that they feel are acceptable to consume. And if they are in a state where they're not able to access those foods, it can create that anxiety and those feelings of guilt and shame. around food. Those increased food thoughts we talked about, body image distortions, an overall sense of a loss of control around food, and then having this mentality that they need to make up for quote unquote bad foods that are consumed. So, a lot of athletes are afraid of carbs, they fear carbs, they consider them a bad food, when in reality, carbs are the body's primary source of fuel for exercise. And then other things like sugar or any processed foods, things like that. And that's when we may see that excessive exercise happening to compensate for that. And then some other physical signs to be mindful of would be any unexplained weight loss, frequent injuries or illnesses, GI complaints, hair loss, feeling cold all the time, just kind of these symptoms that are not, typically normal there. All right, and then I wanted to touch on some of the common eating disorders and what the potential consequences are of these are in athletes. So, anorexia nervosa is, I would say, one of the most commonly known eating disorder. And the key feature here is restriction, fear of weight gain, or fear of becoming fat. And it is common in those aesthetic and endurance type sports, those weight class sports that we talked about at the beginning. Potential consequences include low energy availability, which can increase their risk for REDS, hormonal issues, so loss of a menstrual cycle, impacted reproductive function, and low bone mineral density. And binge eating disorder is characterized by recurrent binge episodes. It does typically happen, not all the time, but we see it in the off season, or in periods of time where the training cycles are different. Maybe they are not training as much. And then in those weight class sports as well, where they're constantly in that weight cycling paradigm there. And so consequences include weight fluctuation, fatigue, OSAFED, otherwise specified feeding and eating disorder, is characterized by subthreshold behaviors. It's common in all different types of sports, whether you're recreational or an elite athlete. And it is characterized by a performance decline in REDS. And then RFID, avoidant restrictive food and intake disorder. Restriction is not typically tied to body image. It's more so concerns like food texture or just not, you know, super hungry or just not, doesn't have, they don't have an appetite. But a lot of times it's related to like textural concerns. And it is common in younger athletes and then also GI sensitive athletes too, and especially those in endurance sports. And so consequences here include low energy availability and nutrient deficiencies. And then last but not least, and this isn't a comprehensive list, it's just one of, the most common ones we see. Orthorexia nervosa is this obsession with clean eating. And this is where we see rigid dietary rules. It can impact all sports, especially those sports we've been talking about, but it's also been seen to impact things like CrossFit. And we do see nutrient deficiencies, social isolation, and REDS risk as well. All right, so transitioning more and talking about exercise dependence some more. So this is defined as that compulsive, uncontrollable exercise despite negative physical or psychological consequences. And then we have primary versus secondary exercise dependence. So primary is due to the sole gratification and psychological effect of exercise, whereas secondary typically coexists with something like disordered eating. We can use what we call the exercise dependence scale as a screening mechanism for this. And it has 6 subscales that essentially classify individuals with risk of exercise dependence. So withdrawal, continuance, tolerance, lack of control, reduction in other activities, time, and intention. And somebody is classified as at risk if they score 5 or 6 on 3 or more of the subscales. They're classified as non-dependent symptomatic, which even if they have that classification, they are still at risk for exercise dependence. So we don't necessarily like count them out. That's going to be scores of 3 to 4. And then non-dependent asymptomatic is scores of 1 to 2. And this is common in those endurance and aesthetic sports as well. Again, it's oftentimes co-occurring with disordered eating, and it is still prevalent in those non-traditional sport paradigms, those team sports, CrossFit, sports that emphasize that muscle culture, all those things we've talked about there. All right, so criteria for diagnosis. So compulsive exercise is going to be characterized by an overwhelming urge to engage in activity. And when somebody's not able to engage in activity, then they get extreme anxiety. And then, they kind of have that kind of negative downward spiral with body image and all that. And then withdrawal symptoms manifest when athletes reduce or stop exercising. And these withdrawal symptoms mimic behaviors that you see in other substance abuse conditions. So, anxiety, irritability, distress, and then ultimately they're dependent on that activity. And the impact on health includes both physical and psychological consequences, so injury risks, stress fractures, fatigue, mental health issues. And so, this is why it's important for healthcare providers to screen for this. And then moving on and talking more about some body image concerns and body dissatisfaction in athletes. So as we mentioned in the beginning, athletes face the that dual pressure, those external and external pressures. So to achieve that performance-based body ideal, and then the societal appearance standards as well. And as I mentioned before, sometimes those don't match up. And so that just creates more and more pressure placed on the athletes. And again, the internal is their own self-imposed pressure, whereas the external is coming from those outside factors, their teammates, their coaches, social media, their family members, any other kind of person or influence on their life there. And this internalization of this thin ideal or the muscularity oriented ideals have been associated with disordered eating. Youth athletes may interpret normal growth as gaining fat, which can increase dieting and body dissatisfaction in that age group. And we do have some best practices when measuring body composition in athletes. So, first and foremost, identifying a clear rationale for testing their body composition, not just testing it just for fun. And in, the past few decades, we used to say that body composition was a direct impact on how they would perform or what type of athlete they are. When we know that's not necessarily the case. So, meaning if somebody has a low body composition, it doesn't automatically make them an excellent athlete. And so again, making sure they understand or what's the clear purpose of doing these assessments in athletes. And if we are going to do them, they need to be administered by trained professionals where confidentiality and privacy concerns are taken into consideration. And also, if an athlete has a history of disordered eating, exercise dependence, or body image concerns, this probably isn't going to be an appropriate measure for them, and we never want to mandate something like that. And then I also wanted to talk about, athlete comments and compliments. So, how should we compliment our athletes? Well, one, we don't want to talk about their body, which in, today's society, that's almost impossible. You never really hear that. And so we want to focus on things like, hey, you were super energetic during practice today. Great PR or performance. You're strong, resilient, and not things like, oh, you look like you've lost weight or you're looking lean. Your body's looking amazing. So taking their body out of it and really just focusing on their performance as an athlete. So the psychological impact of body dissatisfaction. on performance. So negative body image can significantly impair their performance, leading to decreased motivation, focus, and overall effectiveness in their sport. Also decrease their well-being. So, disordered eating and exercise dependence can contribute to mental health issues, including anxiety and depression, which diminish their overall well being and quality of life. So, a lot of times we get focused on performance, and that's the only thing we're concerned about with the athlete. Well, I'm also concerned about their overall health and their quality of life because a lot of athletes, are not going to be athletes forever. In recovery, we want to address body image concerns through supportive interventions and to help them, develop a healthier relationship with food, exercise, and body image while still, meeting their performance goals. So I want to talk a little bit more about low energy availability. You've heard that term a little bit. This is a mismatch between dietary intake and training demands. And if an athlete's in this chronic state of low energy availability, we also call that problematic low energy availability. And if they're constantly not consuming enough to support their performance, then it puts them at risk for relative energy deficiency as in sport or REDS, as I've been mentioning. And if an athlete has REDS, then they have significant health and performance impacts. So it impacts their bone mineral density, menstrual function, reproductive health. It increases their injury risk and risk for things like stress fractures. It impairs their recovery and it decreases athlete availability. So they're not able to do their sport because of these injuries and these health and performance impacts. And these are just a few. It impacts things like their cardiovascular health as well. And luckily, we do have screening tools that we can use to assess for this. So, the LEAF Q or the low energy availability in females questionnaire can be used, and they are working on LEAF M, low energy availability in males questionnaire. So, that is going to be coming out hopefully soon and hopefully validated so that we can assess male athletes as well. And then we have the EDEQ, which is the Eating Disorder Examination Questionnaire, and the EDS-21, as I mentioned earlier, the Exercise Dependence Questionnaire, and then the REDS Cat 2 is it's a bunch of different criteria for the initial screening process. So I know I'm throwing all these questionnaires at you, and you're like, "Wow, why is she doing this? Why do I need to know this?" It's just a good resource to have if you ever find yourself in a situation where, maybe you are working with athletes or an athlete that you're kind of concerned about. It's nice to be able to have screening tools as a first primary mechanism of assessing this risk. And these are all related if you haven't grasped on to that. So, disordered eating, exercise dependence, body dissatisfaction, low energy availability are all etiological factors for REDS. And oftentimes, if an athlete has one, they likely have another one. So, that's why it's important if we are seeing some red flags to screen for this. And again, it can lead to REDS, but it can lead to other things like anxiety, depression, burnout, and impact their overall health and quality of life too, not just their performance. So I wanted to just spend a couple slides talking about some of the latest research in this, starting with trail runners. So this is a study that we published last year. We looked at disordered eating, exercise dependence, body dissatisfaction, and fueling habits in masters trail runners. And this study is actually open access. So I will throw it in the notes section of the slides, and you can see that if you want to read it later on your own time after this presentation. And so our key findings here, we had over 1,000 trail runners ages 41 to 65 years old. Why did we focus on this population? Because, most endurance studies are going to focus on those younger populations. There's not a lot in the master's age population. They did have a high risk for disordered eating and exercise dependence. And so 46% of females and 32% of males were at risk for disordered eating based on the DESA-6, which is just a different type of screening tool. And then 80% were symptomatic for exercise dependence. So that groups the at-risk group. So again, those who are scoring the 5 and 6 on the questionnaire, and then the non-dependent symptomatic, those that are scoring the 3 and 4 on the questionnaire. And then we did observe a significant association for those who were at risk for disordered eating and exercise dependence. And body dissatisfaction, 71% reported being dissatisfied with their weight. And those that were labeled as or classified as at risk for disordered eating were more likely to follow a specific diet plan, restrict their dietary intake, and underfuel their carbohydrates on easy training days. And then also during long training runs as well. And so health and performance implications, disordered eating risk is linked to more injuries and suboptimal feeling in this population, highlighting the need for screening, education, and support in masters trail runners. And then this study is currently in review right now. And we looked at, those non-traditional sport paradigms where this is prevalent. So we had 325 female CrossFit athletes, and then so those that only do CrossFit, and then those that do CrossFit and endurance training as well. And we did see a high prevalence of disordered eating and exercise dependence in this population too. So 37% were at risk for disordered eating using the EDEQ questionnaire. 85% were symptomatic for exercise dependence, which what is higher than a lot of studies in prior research in the literature. And it's also higher than a lot of endurance studies. So very interesting there. And CrossFit only, or those that only participate in CrossFit, showed significantly greater risk for both disordered eating and exercise dependence compared to those who do CrossFit and endurance training. In body image, 64% reported a desire to lose weight, and 58% reported a desire for greater muscularity. And so I threw this in here, this picture, and this, thinner equals faster, or if you do CrossFit, you're gonna have manly muscles, or if you lift weights, you're gonna look manly, or you're not strong enough. So it's kind of, ties it all together that these societal ideals are unattainable, and you can't win basically. And so those at risk for disordered eating were significantly more likely to report a drive for muscularity and to follow restrictive diets. And then regarding fueling for performance, 38% said that they do fuel sufficiently and that they meet the evidence-based guidelines. So this is specifically referring to the carbohydrate guidelines for team sports. And greater than 50% reported that they avoid foods, specifying that they avoid carbs due to body image concerns. And 44% followed coach recommended diets. So, again, highlighting the need for nutrition knowledge in this population, especially when they're relying on coaches for advice here. And then this limited nutrition knowledge and restrictive dietary patterns can increase their risk for low energy availability in REDS. And 44% reported following a specific diet plan at the suggestion of their coach or trainer. And so coaches and practitioners should be screening for disordered eating, exercise dependence, and or if they don't feel comfortable doing that, it's out of their scope, then ideally working with a sports dietitian or somebody that would be able to come in and do that for their athletes. And then, highlighting the importance of improving nutrition education and promoting balanced fueling. So, flexible, varied eating patterns to help eliminate these risks and to create a healthy relationship with both food and exercise while still being able to meet their performance goals. So, are athletes eating enough? My hint is for you is no, they're not. Um, and I know it's hard to kind of measure like what's enough, but when we look at the literature and just based on kind of those studies we've already gone over, we're not meeting evidence-based guidelines. And this was another study in CrossFit specifically where they found that 44% of participants consumed inadequate carbohydrates specifically, and then that 42 and 53% of female trail runners um, reported sufficient carb intake during long races and training runs. And across the board, when you look at the literature, carbs are significantly underconsumed. And so, why are they not consuming enough? There's, a variety of different reasons here. So most of them are unaware of recommendations to begin with, or if they are told a recommendation, they don't really know what that means. And then, of course, there's barriers to fueling. So, do they have time? Are they running from practice to class? Do they have available foods when they're traveling? Just, budgetary concerns, all these different barriers that impact them fueling properly. And then those restrictive practices that we've been talking about, and also some discrepancies in evidence-based guidelines. So some of the literature is not real clear as of now, how many carbs certain athletes need. It's very clear in those like endurance type sports that we've been mentioning, but it's not clear in some other sports. So, improving those guidelines. And then we also have this mentality in athletes of good and bad foods, which can alter fueling practices as well. All right. So, the role of the sports dietitian in this area specifically is primary prevention, so education, awareness on these topics, and then secondary prevention, both subjective and objective measurements. So, screening tools, the ones that we mentioned, ideally making sure that they are validated for use in the population you're screening. Interviews, biomarkers, labs, things that can tell the whole picture there. And then they also work closely with trained, or we want them to work closely with trained physician in REDS and also be a part of a multidisciplinary team that treats these types of conditions. And I can't stress this enough. If the most important thing that I believe as a dietitian and practitioner is to always advocate for the health of the athlete. Again, we get so performance driven and stuck in this mindset of they need to perform their best, they need to achieve this certain body composition, but their health can be suffering. And we also want to consider their overall health when they're not an athlete anymore. And so, being able to recognize the first signs and symptoms and referring to trained professionals for further evaluation is going to be critical in helping treat these conditions. And multidisciplinary approaches we've talked about. So, super important again to have this team and different health professionals that you can work with in this scenario. So, collaborative care combines the mental health aspect and the nutrition expertise to address these conditions, ensuring that both the psychological and dietary needs are going to be met for athletes. And then using evidence based strategies such as CBT, motivational interviewing, can enhance the treatment effectiveness by fostering resilience and promoting these healthy behaviors in athletes. And so, where do we go from here? Well, advocating for athletes and teaching athletes to advocate for themselves, which is very hard for athletes to do. A lot of times they don't feel comfortable. maybe standing up for themselves to their coach. And so it's our job as dietitians to serve as the liaison and advocate for them, but it's also important for them to learn these life skills and be able to advocate for themselves. So, whether that's bringing in a trained sports dietitian to talk to them or to help them with feeling, um, whether it's advocating for not doing a mandatory body composition test, just learning to practice these skills. And we also want to avoid using popular sound bites that cause further stress on the athlete. So things like food is fuel, our bodies are machines, thinner automatically means faster, carbs are bad. And yes, food can be fuel, but it can be a lot of other things too. And it is possible for an athlete to eat a healthy dietary pattern with flexibility and consuming things in moderation and still be able to meet their goals there. And then also, carbs are bad is something I hear all the time. Most athletes that I work with are afraid of carbs. They think that they make them fat, they think they weigh them down, and they're not going to improve their performance. When, I already mentioned this earlier, it is the primary source of fuel for athletes. And so, making sure that we're being mindful of this and not creating additional stress on our athletes by saying these things. And then utilizing body comp best practices, as we mentioned, always having the mindset of health first, performance second, which I know a lot of coaches and people will argue with me on that. And that's okay. I will argue back with them in a very respectful way. But yes, I know performance is super important and them being the best athlete they can be. But I will always say health first and setting them up for success for their life and not just a certain period of time. And I love this figure from this author that has the latest consensus statement out on REDS. And it does talk about body composition assessments and kind of, where they're needed or recommendations. So, in athletes that is just developing or emerging, we don't really need body composition assessments other than for things like assessing optimal growth. But as I mentioned earlier, when they're at this vulnerable age, and I'm telling you, it starts as young as 7 or 9 years old, where they start to have body image concerns or restrictive practices, then mandating body composition assessments is just going to make the problem worse for them. And then when they're at the national or collegiate level, we want to limit the focus on body composition assessments and discussions, and it should only be practiced from a health perspective. And if you're up in that elite or professional category of an athlete, then, body composition assessments can be used only with mature athletes and with positive self body image. So if you're working with an athlete that has any of those concerns, we don't want to make that worse. All right, so some key takeaways, and then I think we'll have some time for questions, which is great. So again, if you have questions, I welcome them, and I don't want you to feel bad for asking any type of question. So, disordered eating and exercise dependence present unique challenges in athletes, necessitating a nuanced understanding of their interrelated nature. So, they're all related. And again, if an athlete has one, they likely are experiencing another one too. So, it's super important to screen for those. It's really important to collaborate, as I mentioned. So, mental health professionals, sports nutritionists, coaches, physicians, athletic trainers, anybody that's working with an athlete, we want to have that collaborative dynamic to provide the best care for the athlete. And then utilizing those evidence based interventions to help improve the athlete outcomes, not only again with their performance, but also help promote those healthier relationships with food, exercise, and body image. So, thank you all. I appreciate you attending, and please ask questions. I'm happy to answer any questions that you have. We have questions.
I have a
Let's see.
question.
Yes.
Mhm.
So, how successful have you been getting into high schools or other areas and being accepted, getting the athletic programs to accept this as a need, if you're doing that at all?
Yeah, that is an amazing question. So, my husband's a high school football coach, and so, we're constantly going back and forth on these topics. But I think the more, my name gets out there and the more that coaches are willing to kind of learn and see a different perspective, they will entertain the idea. But I will say it is hard in some paradigms. Some coaches are just not interested, but it is super important to create that awareness. So I'm doing all I can to, speak to even local schools. And I have done some speaking in athletics here on campus, which is good, but it is a challenge. I will say that for sure. Other questions?
Okay, okay. Any questions? I'll ask why while Sylvia, can we have a copy of the PowerPoints? We're planning on doing that if we can. And so we'll definitely touch base if we're able to do that. Um Latoya said, I would love to connect with you. I'm currently working on my capstone focused on mental health risk among youth elite athletes. Awesome.
Oh, that is amazing. Yes, I would love to connect too. And feel free, my contact information is down here on the slide. I'm happy to connect with anybody for anything. So drop me an email. I'd love to connect with you and chat about these topics further at any time.
Awesome, awesome. Now, when because you mentioned a number of things that I found pretty fascinating, especially with I guess the behaviors of athletes when it comes to carbs. I can't lie, I'm kind of sometimes scared of carbs myself. I just learned a number of years ago that carbs were all right. It was about 10 years ago, and that we actually need them. But for many years, I thought that carbs were not good. Um, and so I was just wondering, like, with a lot of the athletes that are having these issues with carbs, do you believe that? I mean, is it a lack of education? What is that all about? Just the issue with carbs.
Yeah, I think it's multifactorial. I think a lack of education, not knowing how important they are for performance. So I do work with a lot of athletes that restrict carbs, and 9 times out of 10, they come back and they're like, okay, I had energy for performance. Like that feels amazing to be fueled for my sport. And so just debunking some of the myths that are out there that they are bad and that they do support your performance, creating that education and awareness, but also advocating comes into play here too. So as I was mentioned, like, their coaches, whoever that they're working with, they don't know everything, just like I don't know everything. And so being able to advocate for a sports dietitian to come in and provide that education is key. But we're also navigating those fears around carbs too.
Definitely, definitely. All right, all right. I got a couple more questions. We gotta stretch this out a little bit more. And I think it's some things that I'm interested in. You all drop questions or come off mute if you have questions. But I wanted to ask about the thing. I always thought it was a positive quote to say that food is fuel, but apparently, based on the situation and circumstances, I don't know if that's a trigger or can lead to unwanted behaviors as far as eating. Can you elaborate on that?
Yeah, that's a great point. So that's something we've heard, our entire lives is that food is fuel. And it can be fuel, but it can also be other things. It can be enjoyment, it can be family traditions, it can be cultural preferences. And so it's not just fuel. Yes, it does help fuel our bodies for performance, but it makes up these other components too. And so a lot of times if that's like a lot of my athletes that I talk to, they're like, well, that's all my coach ever says, and that's ingrained in my brain is that food is fuel, food is fuel. And I'm like, you're not wrong, it is fuel, but it's these other things too. And so it's creating or helping them create a healthy relationship with food. It's saying that yes, you can, pay attention to what your body needs to support your performance, but it's also okay to have a cookie after dinner.
Yeah,
I
it's
know, I
okay.
said it. I
A
said
lot
it.
of us like to hear that, but that was like, I don't know, I hadn't heard that. That's false
You're
doctrine.
like, is she really a dietitian?
Yeah. Definitely, definitely. Oh, we had some questions populating the chat here.
Good.
Erica said, "Yes, can you elaborate on those common phrases being used? I guess about common phrases being harmful. I guess some of the common phrases. And she says, yes. Can you elaborate on those common phrases being harmful? So I guess maybe some of the phrases that you may have mentioned and why they might be harmful.
Yeah, so we talked about food as fuel, like our bodies are machines, if we're constantly saying this to athletes and just individuals in general, then they think that that's all that is. And that can create those triggers, as we mentioned, especially if they have a history of disordered eating or exercise dependence. And it can also create a bunch of anxiety around food and create fear around food, which
Mm.
all those things are going to worsen those behaviors that we talked about.
Definitely, definitely. All right. Wanda said, helpful information. Thank you for the presentation. Leslie said, what do you recommend as an athlete transitions back to their support as they recover from an eating disorder?
Yep, that's always very tricky. I recommend that they continue to work with both a
Oh,
dietitian and
transitions back to their sport. I'm sorry.
okay.
That was a typo there.
No, you're fine.
Mhm.
A lot of them will be cleared to return, and I think that's great that they've recovered, but it's going to be imperative that they still work with a dietitian and they still work with a therapist at minimum. Because one thing with eating disorders is it is a journey, and recovery doesn't just stop when the athlete feels like they're recovered. It's kind of a lifelong journey. And so making sure that they have somebody that they can lean on and that they can reach out to when they are returning that they trust. And then also, ideally, making sure like the dietitian or whoever they are working with has a good relationship with their coach or the strength coach or the athletic trainer, just somebody that they have a good relationship with so that they can all work together for the athlete's health.
Definitely, definitely. This one I'm dying to ask. Um, GLP.
Oh,
Um,
GLP.
yeah. How is that trending? So, my wife was bringing attention to me about, I guess, a statement that Serena Williams had made because I think I hadn't seen it myself all the way, but apparently, she had been, she of course was one of the more muscular, was what sometimes she would be called stronger athletes in her build. And
Mhm.
according to what my wife had said, that Serena had mentioned that really she like kind of the build, I guess, of her sister, or she didn't feel that her build was very ladylike. Um, and I'm please don't quote me on this, but something of this nature. This is third hand information.
Yeah.
But apparently, even with all, and I did hear this from the commercial, with all of the technology and the coaching and everything that has been out there, apparently she was having trouble getting to the size. A lot of people looking at her like, whoa, she's just, getting to the size that she desired. And it's making me think about Oprah too, because Oprah struggles so much. And you're talking about somebody has hundreds of millions of dollars, billionaire, and having issues with weight. And sometimes it's not because you're not eating right or you're not exercising. So Serena was saying, hey, I couldn't get where I wanted to. And that's discouraging for me. I know I'm trying to cut some belly fat, and it's resistant. But tell me a little bit about how this is, entering into the sports arena, considering that we're seeing like remarkable changes with the GLP additions or the GLP use. I know it's supposed to be, I think, given by script, but we know how that goes too. Tell us a little bit about that.
Yeah, no, that's great. I'm glad you brought that up. And I think a lot of people were disappointed, when she came out and said that because they were like they looked up to her. But again, we can't speak for her and what she's going through. But I will say like there's so many different factors that play a role. When I was in school or when we were doing our dietetics degree, all we heard was eat healthy and exercise and you'll be fine. We know that's not always true, right? Like there's genetic factors, there's
Oh
hormone
man.
factors, there's all these different types of factors. Some individuals are just built differently. They have more of a muscular build. We have what we call a set point theory, which is where your body adapts to a certain weight, and that's what's best for you and your body. And so
Yeah.
it's constantly navigating all these BMI, doctors are always using BMI, all these things that classify us when there's a bigger picture here. And with athletes, I haven't seen a lot in the literature yet, but I am concerned that if they do reach athletes, that we're going to see more, low energy availability and REDS risk because with the GLP-1s, appetite is severely diminished. And so I don't know, how they're going to be able to support their performance if they're on a
Mm,
GLP-1.
wow. Wow. Great answer. We've got like about two more questions I'm gonna take, and then we're gonna wrap this up. And this has just been so informative, and we definitely appreciate it. One question is, um, Leslie said, do you have any recommendations as far as reading or resources?
Yes, so I linked a bunch of references in the PowerPoint, and I'll drop the REDS consensus statement that I mentioned from that Montjoy et al. 2023 in the comments. I would highly recommend that on REDS, and then the Wells paper that's also in there is super informative for disordered eating. And then all those scales I linked, like the exercise dependence scale, Hasenblatt's is linked in there too, and she has a lot on exercise dependence too. So those would be my top recommendations, and I'll drop some of those papers in the comments of the slides.
Mm, that's interesting. That's good stuff. You said Hasenblatt's, and I'm just thinking of this eating. I was thinking about some Haagen-Dazs, but I'm just gonna stay focused. Didn't get it yet, but hey, it's all right to have some cookie or ice cream sometimes. You know what I'm saying?
Everything in
The
moderation.
cookies and ice cream. All right. Laquanda says, I'm far from my athletic days, but I'm 3 months postpartum. So this was very informative for me as I try to navigate my way onto exercising again. That's amazing. Mother to mother,
I
right?
was gonna say, yes,
Mother
I
to
can
mother.
relate. Yes. And I love that she mentioned that because I do work with athletes, but my pregnancy postpartum experience made me want to work with new moms too. And so
Yeah,
I'm currently working with new moms as well. So I feel you, sister. It's a grind, but we will get back there.
definitely. And last question, do you feel like the BMI chart is accurate when it comes to the doctors utilizing it? That's a really good question, April. That's from April.
Absolutely
I
not.
don't like it.
No, I hate BMI. You know, we have to teach it, but I'm just hoping one day that somebody's just like, please take away the BMI scale because it does not depict the entire picture. It doesn't account for body composition. It literally takes height and weight. It doesn't differentiate muscle mass, bone density, all those things. It doesn't look at somebody's blood pressure, their glucose, their biomarkers, all these indicators of health,
Yeah.
that make up health in an individual. So I hate it. I hope that it goes away sometimes because, again, and like it's just not possible to determine somebody's state of health on their BMI alone.
Awesome, awesome. Anaya said, my nutritionist said no food is off limits. It's just about balance and moderation. I hate BMI. According to that, I've been obese since middle school. That really can affect somebody's mental. I'm telling you. I'm
It
telling you.
does. It does.
Yes, yes. All right. Well, we are going to wrap it up. And Dr. Reno Smith, we really appreciate this presentation. We want to give you a virtual round of applause for this awesome presentation. And it's been very engaging. And maybe we hope to have you back one day soon because this is very, very important. This is a very, very important topic. I don't believe it's talked about enough, but it's awesome to know and to hear from someone who is out there hands on and educating and making lives better. Well, we're going to end it here. Once again, we thank all of you all for supporting our training here. Expect to receive a continuing education within the next couple of days, max. And if you have any trouble with that, just let me know. We will be planning, I believe, to have another training in October. So keep a heads up and we'll try to get that information out. But as for now, we will see you again on next month. Blessings to you all until we meet again. Y'all take care now. Bye bye.